All right. Hey, everybody. Here we are. It is Wednesday afternoon. It's me and John D'Ambrosio together again.
Yes.
Man, I miss you. I miss our podcast
Oh, I
days.
missed you too. Those were fun.
I know. So anyway, we are halfway through our week. We're at our Wednesday workshop. You guys know why I do these on Wednesdays is because it's halfway through your week. And if you guys are like the rest of us, you need something to boost yourself through the rest of the week. And so today, John's going to be teaching on philosophy, and his title totally intrigues me. I can't wait to see how this unplays because his title of what he's going to be teaching today is Philosophy Never Paid My Bills, but. So I'm
Yes.
really excited to hear what the but is. So without further ado, John, why don't you jump right in and let's teach philosophy.
All right. And then I'll show you my butt.
Okay. Oh
So,
gosh.
all right. So, philosophy never paid my bills. But the reason I titled it that is because I've been to a lot of philosophy talks. And when I go with certain people, they kind of joke around. They say, well, philosophy never paid my bills. And it's true. It really doesn't. You could have the best philosophy, you could have the worst philosophy. It's not going to pay your bills because it's what you do with that philosophy that makes a difference. You
Mhm.
could, and you could argue that maybe if you don't have a good chiropractic philosophy, you may be it may be easier for you to make money because you compromise, chiropractic principles and you see anybody for any reason. And it's all individual. I don't agree with that, but people, have a right to practice. You get your license, you could really do what you want. But philosophy to me is like the rudder of the ship. So you have this practice, and yeah, you need to get out there and do what you need to do. But if you don't have a strong philosophy, why are you doing it? I mean, I want to get up in the morning knowing I'm going to help people and in the way that is congruent for me. And I want to go to bed at night and be able to sleep. And for me, philosophy is so important in that because I got into chiropractic not for back pain or neck pain, but because my sister was helped by a chiropractor. She had skin and breathing issues when she was very young. And through chiropractic, she ended up getting better. And I didn't even realize it back then, but that could have been sort of an outside in approach as opposed to above down, inside out approach. And you say, well, what do you mean by that? Well, if she went to the chiropractor for the sole purpose of treating her skin and breathing issues, then that's really just kind of using chiropractic as medicine. And there are a lot of people say, well, I'm very holistic. I don't take aspirin. I don't do anything. If I get a headache, I go to the chiropractor. Or if I have stomach issues, I'm going to take this herb. Well, you're just taking the medical model and you're using natural means, but it's still the medical model. And
Mhm.
chiropractic does not, it's a separate and distinct profession. And that's huge to understand. And we have gone over these books. This book, Rob Sinnott's book, the textbook of chiropractic philosophy, huge. And you say, well, this is so basic. I mean, why don't you read the green books? You read this first and you'll better understand the green books because it puts it at, I don't want to say an elementary level, but it is very elementary and people need to understand that. And then
I'm
this book,
smiling because that's my level.
well, it's important because you may understand things at this level, but when you're talking to people who have been, their whole life has been medicine and pharmaceuticals and what they've heard on TV, you don't want to go in at a green book level. You want to go in at this level and explain chiropractic to people because they'll get it.
Yeah.
And this book, I have Joe Strauss's blue books and I've read through a bunch of them, but I've had this book for probably 20 years. And it's called Enhance Your Life Experience. And I never even bothered reading it. It was just sitting around, but I found it when I was going through some stuff 2 weeks ago, and I'm on my fourth read through this. It's that good. And it talks about the difference between above, down, inside out, and outside in philosophy. And it's not a chiropractic book, although the very last chapter does mention chiropractic. It's just about talking about health and how you really get health and how chiropractic or anything really should be focused on raising your health level, not treating disease. And that's huge because most people, even a lot of chiropractors, again, they'll say, oh, yeah, I help this person with back pain, or I help this person with eczema, I help this person with infertility. Well, if you're trying to treat that as opposed to bring the health levels up so the body can heal itself, you're kind of missing the boat. And yeah, you're helping people, but you're not really educating them because they're just looking to treat some sort of a symptom instead of you going in there and say, well, I'm going to work with the cause. And let me look at my notes to make sure I got everything here. So, yeah, so if you're going into something with a holistic mindset, it doesn't mean I'm going to treat them naturally. It means I'm going to focus on raising their health. And the way it's explained in this book, and that I really like, is you have the sperm and the egg come together, and there's a spark, and then these cells begin to differentiate, and they don't just all the same cells. You get the nervous system, then you get the kidney cells and the liver cells and the skin cells and the muscle cells. There's this amazing intelligence within the body that is able to then create this human being, this functioning human being. Now, that intelligence does not disappear once you're grown or once you're born. It continues. That's what's digesting and assimilating your food. That's what's, your immune system. If you get cut, that's what does the healing. So that's amazing force within you. Again, it doesn't stop. So it's like analogy is, if I can lift a 100-pound barbell, well, can I lift a 10-pound dumbbell? Well, of course I can. If the power that came together to take these two cells and create a whole human body can do that, can it fight off an infection? Can it heal a cut? Can it help mend a bone? Well, of course it can. Those are easy for the body. You just have to make sure that the body is able to do that by giving it proper food, proper exercise, proper rest, and most importantly, a clear nervous system, because everything filters through the nervous system. If your nervous system isn't functioning optimally, you could eat the best food, but are you going to process it properly? Are you going to take those nutrients out of it? You could do the best workouts. And again, are those muscles going to heal properly? Are they going to then adapt and then overcompensate and grow? Are you going to be able to get a good night's sleep? And during that period, really sleep, go into rest, heal, and repair. I had somebody come in. She literally had not slept for 20 years. She would take medication to sleep for 20 years. And this was her daughter had actually referred her in. And she said, my mom doesn't sleep. She takes this medication. And we were out on a girls' weekend, and I took some because I couldn't sleep. She goes, I was in a daze for 3 days. That's how strong the meds are. So the mother came in. She came in because her hip was bothering her. She has a torn labrum, and she's trying to avoid surgery. I explained what I do, went through. It made sense to her, and started adjusting. The first adjustment, I had her go into the resting room, and I said, you may fall asleep here. And she laughed at me. She said, I can't fall asleep at night without medication. I'm not falling asleep here. Passed out.
Oh my
She
God.
was out like a light. And since then, she's off her sleep medications. She's sleeping much better. Her hip feels great. She's going on a walking tour of Italy. And this is something she couldn't have done, but I never treated her sleep problems. I didn't treat her hip. I worked on building up her nervous system so her body then could then heal itself. And that's a huge part of philosophy, because it takes the burden off of you, and it puts it on, I don't even want to say it puts it on them, it puts it on their bodies, because you don't know what their limitations are. I mean, this woman was in her 70s. She spent a lot of time not taking the best care of her body. Did I know if her hip was going to get better? Did I know if she was going to sleep better? I had no idea. I expected those things to happen once her body was able to start healing itself, but that was because I had a strong philosophy. If my goal was, I'm going to treat that hip, I'm going to treat that sleep issue, I would have
Right.
taken a totally different approach, and maybe it would have failed. So it's so
Yeah.
important to be grounded.
Yeah, and I want to circle back to your title now, John.
Yeah.
Philosophy never made me money, but, and one of the things that just stuck out to me when you were telling us this story is that before you even laid hands on her, you took the time to tell her what you were looking for and what you were going to do, and you really took the time to tell her about how chiropractic works. And I'm sure, I'm sure, knowing you, you communicated that you're not treating her hips, you're not treating the sleep disability. You're if you want to use the word treating, you're treating subluxation.
Right.
You're removing subluxation, you're removing interference to the nervous system, allowing the brain to be able to talk to the body so that the body can heal itself. And I think, to circle back to your title, all that to say, is your philosophy is never going to make you money, but how you communicate your philosophy will absolutely make you money.
Definitely. And if my philosophy, and everyone has a philosophy, whether they admit it or not, it could be a medical philosophy. If my philosophy was we're going to, let's see, what controls sleep? Well, okay, the melatonin is made here, blah, 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 blah. Let's adjust this segment because we're trying to treat your sleep, or we're trying to fix the labrum. So let's work on this. I mean, again, that would be my philosophy, and that's how I would communicate it. It would not be a philosophy congruent with what I believe, but everybody has a philosophy. And I think a lot of times that's where the problem comes, because if you say, oh, above, down, inside out, yes, 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 and then you're treating back pain with an adjustment, well, that's not congruent, because one is the body can heal itself, and the other is I'm going to treat this with this natural means. There's a
Mhm.
clash there. And I think that is going to limit your growth.
Oh, I would absolutely agree. And it's frustrating, man. Like when you have a pain-based practice, because I think we all, no matter how much we're immersed in chiropractic, I think we're all human beings and nobody is perfect. Nobody's perfect in their communication 100% of the time. And I've even seen myself over the last 25 years in practice where like I would dip into these, I wouldn't be paying attention. I would lose my focus. I wasn't paying attention. And I would like almost dip into like a pain based practice. And the frustration levels of like that type of practice is, I mean, it's enough to make people quit practice because
Yeah,
if I was dealing with, we see between 80 and 100 people a day. If I had 80 people telling me, "Doc, it hurts here," or "Doc, here's the pain, here's the pain, here's the pain, here's the pain," and I was focused on getting rid of that pain, I couldn't do it. I would be freaking exhausted by the end of the hour, not even the end of the day.
exactly. And that's not something, again, we can't control that. I mean, we like to think we can, but the body's going to do the healing. I mean, we have no choice to, whether you like it or not, you're going to go in and do the adjustment, but the body's going to either heal or not heal based on what's going on. And so many people think, well, I've been cranking on their low back. Why don't they feel better? You're not treating that. You are looking for the interference and removing it. And if you're not removing the interference, obviously it's not going to heal. If you're just
Mhm.
focusing on the spot that's in pain, I mean, how many times, and I know, preaching to the choir, has someone come in and they do say, oh, my low back hurts, and you never touch their low back. And it's like,
Mhm.
that wasn't the problem. But if you took an area that was in pain and said, well, I'm going to just keep work, you're going to take a stable, healthy area, and you may make it unstable, and you may make the condition worse because
Right.
you're trying to treat something, and the source of the pain, of the problem, may be interference up at C1. You don't know.
Right. Right. It's funny. You want to hear kind of a funny story? You'll appreciate
Yeah.
this, but I'll never forget this because when I was back in chiropractic school, they made us take, PT classes. I don't know if at Parker, we had to take PT classes because we had to pass the PT part of the board. And I remember the instructor was a chiropractor by name. If you ask me, it was a chiropractor by name, but by degree, but he wasn't a chiropractor. And I remember he was talking about, I think it was like muscle stim or like ultrasound for the low back. And I raised my hand and I asked him, I said, well, what if you practice real chiropractic? And you're not planning on using any of this stuff. And he like tongue in cheek was like, well, I guess you'll just have to adjust the atlas then. And that was his answer. It was his response. And it was so funny because like 30 years later, I still remember that like experience that I had in chiropractic school. And anyway, that was just like a funny story that you just when you said, maybe the interference is at the atlas, maybe the interference really is all the way
Yeah.
up at the atlas. I remember one time when I was new in practice, I was 24 years old when I opened my practice, and this woman came in and she was like, she had a surgery, but she wasn't able to have a bowel movement after the surgery. And kind of like the same thing, most people would look for subluxations or look to adjust the low back. And I actually adjusted C5. I did a C5 drop. It cavitated like a rocket ship and she ran off my table and ran to the bathroom. It was an immediate response.
That's great. And it just
And that was up
shows,
at C5.
right.
Yeah.
You need to meet the subluxation where it is. I don't remember who said it. I think was it Gant said, find it, fix it, and leave it alone.
Mhm.
And that's it. You really have to trust the body is able to handle itself, and you can't sit there and be looking for causes of, oh, your back hurts, your headaches. It's just it.
Not your job.
Again, it's really not, and it's hard because a lot of the schools don't teach it, and we're all in the medical model.
Mhm.
It's just kind of what's shoved down our throats all the time. And even with, therapies, I used to be so against them. And I think they have their place if you're using them
Mhm.
to help or fuel the body. If you're saying, well, I'm going to give you this curcumin to reduce inflammation, well, I disagree with that because the inflammation is there for a reason. But if you're
Mhm.
giving, someone may be um, nutritionally deficient and you recommend them to take up, this is a good whole food supplement, it's going to fuel the body and help the body after the adjustment, that's great. Therapy should never replace the adjustment or try to push the body to do something that you want it to do. But if it's going to
Mhm.
enhance the overall health of the body, I'm for it. If someone wants to go out and exercise, oh well, you should have to ask me exercise advice. That's not chiropractic. No, because exercise, sleep, exercise, and proper diet are all important. And
Mhm.
they are enhanced, they can enhance the adjustment, and the adjustment can enhance how those things are processed. So I have no problem with somebody recommending them. Now, I don't think somebody should have like maybe a gym in their office and say, okay,
Mhm.
your low back hurts, we're going to strengthen your low back. Again, I think it should be looked at, we're going to raise your health level by having you start to exercise or move more, having you eat healthier, having you, and if they're not doing those
Mhm.
things on their own, and you need to educate them on how to do it, or you need to kind of help them, I think that's great because we are a major facet in health, but we're not the only one. We want to
Right.
make sure people, you could adjust somebody beautifully and then they go out and eat McDonald's and sit on their phone all day and, don't sleep at night. They're just going to continually subluxate and their health is going to deteriorate regardless of what you're doing.
Yeah. Yeah. John, how, because, don't forget, I would probably guess that the majority of the people that are watching our, what was supposed to be a Facebook Live that did not
Right.
end up really great, um, are maybe newer chiropractors or people opening their practice, because this is in our group turning chiropractors into business owners. Um, I would imagine a lot of people are thinking right now, okay, guys, I understand what you're saying. I get it. And I understand the philosophy. I get it. But when a patient does come in and they say, "Oh, doc, my back hurts here or my neck hurts here," how do I handle that with them without making them feel like they're getting blown off?
I mean, you want to acknowledge, I mean, that's the funny thing. A lot of different practice management say, well, you have to meet the person where they're at. But
Mhm.
meeting them where they're at has different sort of connotations. You could say, oh, we're going to take care of that back pain. And then you try to convert them later on. Or you explain, okay, that's telling us something. There's something going on. Your body is sending a signal. We're not going to sit there and put the tape on the check engine light. We are going to work on improving your health, and through that we expect this to resolve. And you can ask them, well, how do you sleep? Well, I'm a stomach sleeper. Okay, well, that's really not the best position because it weakens your abs and it puts a lot of stress on your lumbar spine. You could touch on things like that because you want to give them sort of home care things that they could do that kind of makes sense. But saying, oh, we're going to handle that, that low back pain and making it their focus. You want them to be heard, and then you want to gently redirect them and saying, we are going to open up your nervous system so your body can heal. And touching the areas um, that, if they say, oh, my back hurts, I don't like touching an area and they say, oh, where does it hurt? And then I'm poking around there. As I'm adjusting, we're clearing up your entire spine and the nerve flow is going. And then you run your hand down and you focus on, I always like to touch in a positive way, not in a negative. Oh, does this hurt when I do this? Does it hurt when I do that? Because you're just kind of reinforcing that. And it's like, well, you're focusing on the pain. Great. And then all of a sudden you say next, well, we're not really focusing on the pain. Yeah, but you were just asking me, you were poking there. And I mean, again, you can't contradict yourself and it's hard. You want
Yeah.
to be a caring person. You want people, I mean, people are people pleasers. A lot of times you get into a profession where you're helping people and you want to make them happy and you have to draw the line between making them happy and doing the job the right way.
Oh, I like the way that you put that. You have to draw the line between making them happy and doing the job the right way. I like the way you phrase that. Yeah, you say a lot more than I do. I say, all right, got it, lay down. I go, I'll check you for subluxations. I go, John, if you have subluxations that's interfering with the communication between your brain and your body, would you like me to clear them out? And they go, yes, doc, please. I go, okay.
And that's great, and that works wonderful for you. My concern doing that would be, oh, will that make my pain go away? So I try not to even, again, I want to address it and let them know they're heard without letting them think that's what I'm treating. And that
Yeah, I
works
think
really well for you. I think you have a very fast-paced practice. So I think you plant the seed, you get them going, and then they walk out. It's like, okay,
yeah.
I don't think they have time to really, yeah, but, because you run like a machine. Your office is very efficient, it's very caring, but there's no time for that kind of talk.
Yeah, there's no chit chat. But you hit the nail on the head is that you said they want to be heard. Guys, write that
Right.
down. They want to be heard. Pay attention to them, honor them, like respect their time, appreciate them, acknowledge the word is acknowledge. Acknowledge that they have a concern. And I think when people are not feeling acknowledged and appreciated, that's when they leave the practice.
Yeah. Oh, absolutely. Yeah, they could have an issue that doesn't resolve and still feel heard and cared for and not leave because they understand what's going on versus, they could even get better and then be like, I got what I needed out of this place. I'm out of here.
Yeah.
And
Yeah.
getting better again, you have to be careful because they're getting better. What does getting better mean? Well, my symptoms are
Right.
gone. Well, you're not really, you're basing it on that. And you always got to bring up that, well, you go to the dentist and you think everything's great and they tell you had 3 cavities. You didn't know you had
Mhm.
them. The dentist had to find them and they've been there going on. The chiropractor is the same way. You don't know you have nerve interference through subluxation until a chiropractor checks you. You may be clear, you may not be. So, I
I'm
mean, you
so
just
glad.
gotta throw analogies in all the time for people.
Yeah, I'm so glad too that you said that. You actually opened up a whole nother can of worms that we could do a whole nother half hour on just that
Maybe we should.
alone. We definitely should. We definitely should. But that is true. Like I hear people because I help people, well, you know this. I help people open up new practices.
Right.
And when they get open and they get going, they'll say, I don't understand what happened. Like this patient was such a great patient. They did really well. They got better and they quit care. And they're like so confused as to why they quit care. And my first question is, well, how are you determining that they got better? And of course
Exactly.
their answer is, well, their X went away, their pain went
Right.
away, their asthma went away, their something went away,
Right.
So even in our own minds as chiropractors, we have to constantly remind ourselves that just because a symptom, even if it's an organ symptom, goes away, that doesn't mean the person is healthy. And then what we don't have the time today, but what we could do a number two, like a second video on is, then how do you determine if somebody is healthy? Like what tools do
Right.
you use? Like how do you know if the nervous system is functioning, if the nervous system is clear, if the body is truly healthy, if the body's truly functioning? What's that determination and who
Yeah. And
determines
that's
that and how do you determine it?
and that's so important. I mean, and not just in your 12 or however many visits you do a re-exam, but every visit you want to make sure you do a pre and post check. Are they subluxated? Are those subluxations cleared? And they
Mhm.
don't leave until the subluxations are cleared. And you have to, if you just come in and do the same thing every time, never check them, you're not really, again, you're not really practicing chiropractic. You're just manipulating because you don't know where the interference is and you don't know if you've done the job of clearing it up.
Yeah, exactly. Well, John, we are rounding up on our half hour for our Wednesday
Awesome.
workshop.
Okay.
Did you have anything else that you wanted to add or share today before we
No, I
lock and
think that
load?
was it. Just like I said, I recommend these 2 books, A Textbook of Chiropractic Philosophy by Rob Sinnott and Enhance Your Life Experience by Joe Strauss. I believe they're probably both available on Amazon or they might have their own websites. But I would highly recommend everybody get those books and really get grounded.
Awesome. Yes, they are. Well, I never read that second book, but
I would highly recommend it.
yeah, awesome. Did somebody just get into the car with you?
Yes.
Is that Rose?
Hi, everyone.
Hi.
All right. Well,
The good thing James is editing this. All right, you
yeah.
guys.
All right,
John,
Nicole.
thank you so much. I'll talk to you later.
All right. Sounds good. Thanks.
All right, take care.
Bye.
Bye, guys.